It's several decades since I was a student at Queen Elizabeth College in Darlington, but it was 2 years that I enjoyed very much. And I actually managed to dig out a photograph of the time when I was there. And this is a photograph of the drama group. At that time, I was working in the background, not on the stage. But this picture is actually taken on the stage in the QE Hall. Well, thank you very much for your questions. I've got a colleague here who is actually going to put the questions to me, and we'll take it from there.
Do you think pay for all key workers should be increased, especially after the crisis?
Well, yes, I certainly do, and we know that the value of pay for nurses, doctors, care workers and all manner of other people who are key workers has actually deteriorated in value over the last 10 years of Tory government rule. You know, they simply haven't been valued, and it really gets my goat when I can see Boris Johnson and other Tories standing on their doorsteps or standing in the street applauding health workers when they have no intention of giving them the sort of pay rise they deserve. So I hope that we can persuade them that you know, they're worth more than a clap around the streets, that they should actually have proper pay, and we should restore it to the levels and the values of 2010.
If you could do one thing to improve an area of the NHS, what would it be and what would you do?
I would want to see the full integration of social care into the National Health Service. I think the only way that we can actually make sure we take pressure off the hospital is to have a care sector that works well, a care sector in which workers are properly paid for the tremendous work they do. When you think in terms of you know, care workers, they look after some of the most vulnerable people in our society. We trust our grannies to them, our mothers, our fathers, so many other people, and yet we devalue them. So the one thing I would like to have is an integrated system where one organisation would be planning the care and you know, from one end to the other.
Do you think the pay for key workers in the NHS is sufficient and enough?
Well, this is a similar question to one earlier, but I don't think people are paid enough. I think they should have the same value of their pay of many years ago. I think it would take something like a 15 or 16% pay rise in order to restore people's value back to what it was before. But it's not just a case of you know, restoring the value of pay. I think we need to increase it as well, particularly for care workers who, as I said earlier, are looking very, very specific, looking after, you know, some of the most vulnerable people in our area, and yet the vast majority of them earn no more than minimum wage.
What, besides coronavirus, do you think is the biggest public health issue facing the UK at the moment, and how do you think we should deal with it?
Well, I think that's an interesting question. I think this is probably the most difficult, so maybe the prize goes to this question in the social care section. But to be honest, I'm not too sure what's going to come next. I think one of the issues perhaps is our preparedness. You know, we weren't prepared for the coronavirus, and so I think the biggest crisis or the biggest issue that we have to face now is how do we make sure that our country, that our NHS, that our care system is ready for the next pandemic that comes along.
How can we bridge the gap between healthcare and social care?
Well, that goes back to the issue about how we actually organise the whole service. I do very much believe that we should have one integrated service. At the moment it's split, of course, between the National Health Service and local authorities. Well, I would much rather see much closer working together so that we can get to a situation where there is that continual, you know, if you like, that pathway of care all the way through.
How can the step up between service provision be improved when we move into adult services when we reach 18? For example, moving from CAMHS provision to adult mental health provision.
Well, this is a cracker of a question. I spent much of my political career as a councillor, as the lead member for children and young people, and I spent a lot of time on this particular subject about how we make sure that that transition from children's services to adult services is as smooth as it possibly can be. That's why I believe very much in pathways rather than having age breaks, and I would like to see, you know, a fund of money, if you like, follow the individual and look after their particular care needs, regardless of where they fit into the age brackets.
Should nursing students who have helped during the pandemic get their fees or student debt removed?
Most certainly they should. They've done some tremendous work, and yet we find a situation where the government, not only did they do away with the bursaries for student nurses, but now we face a situation where they're not even prepared to recognise the work they've done. They most certainly should do that. For me, I would pay them the rate for the job, because believe you me, they've been doing the job as well.
The population is quickly ageing, and this is going to put a lot of strain on health and social care services. How can the country make sure that people get the support they need when they get older?
Well, this boils down to the amount of money that's in the system. I know that, if you think just in terms of care homes alone, they talk about the fact that the fees that they're paid for looking after people are too small. But of course, it's far, far more important for us to develop community services to ensure that people stay in their homes. My own parents, they'll be 89 and 87 in a couple of months' time, respectively, and they still live in their own home. My mum, she has dementia. My dad looks after her, but they've got a tremendous support package behind them, and we need to make sure that as we develop social care into the future, that we have a situation where everybody can get a tremendously high level of support so that they can stay in their own homes as long as possible, because that's what they want to do.
I saw on the news that COVID-19 is increasing the risk of mental health issues across all age groups, but especially children and young people. What needs doing to try and reduce this?
Well, I'm really worried about the mental health of people as a result of the coronavirus. But it's not just about the coronavirus; it's about the whole world of mental health services in the UK, because they are totally inadequate. We've had local problems across the area in which we live, where the service has been far from satisfactory, and young people have lost their lives over the last few years, and that is a totally intolerable situation. What we need to do is encourage more people, perhaps some of you sitting watching this film, to actually specialise in mental health services, because we need many more people in the system. We need to build our expertise, and we need to make sure that the resources are right so that people get the services that they desperately need.
I think children start school too young in Britain. Do you?
This is a really interesting question, and I did a bit of travel as a member of the Education Select Committee, and I visited Denmark and looked at their system, where children actually go to school quite a bit later. But they have a tremendous system there for nurseries and preschool education. So I suppose the children are still being educated, but in a very different way, in a much more fun way. And perhaps that's something that we should be looking at seriously in this country.